As I told you before, I had 37 years of low back pain and very little relief. So the first thing I wanted to find out after nothing worked was, why did I have so much pain? And I found that, in fact, most low back pain does not come from the spine. The International Association for the Study of Pain said that only 4% of low back pain came from fractured vertebrae, only 3% from a narrowed spinal canal, only 2% from a problem in the abdomen, only 0.7% from cancer that had spread, and a minute amount from infection in the spine, and 90% was totally non-specific. And I want to tell you about what I investigated and found, and I'd like to tell you that I think this non-specific pain comes from your sacroiliac joints. Now, what are those joints? You see, you have the great big bones of the ilium here. You're sitting on those sits bones, which are part of your ilium, okay? And they join just below the spine, a triangular bone called the sacrum. So these joints are here, the sacroiliac joints. And what do these joints do? Well, these joints actually... This is your sacroiliac joints. This is where the ilium meets the sacrum. And every step you take moves the sacroiliac joint. It is your body's main shock absorber. It protects your spine from the shock of every step you take. This is your sacroiliac. Sorry. So essentially, the sacroiliac joints absorb the shock whenever you're walking, as soon as your foot hits the ground, the jolt from the foot hitting the ground is going right up your leg and ends up in your hip joint, which is inside your iliac bone, and that moves the iliac bone, and that absorbs the shock to protect your spine against the shock of every step you take. So if when you're running or you're walking or you're using the stairs, if that causes pain in your back, then you know the pain is coming from your sacroiliac joints. Now, people who sit for a long time often get low back pain, like airline pilots, like long distance truck drivers, like people who spend hours and hours on their computer will get low back pain. Why did they get low back pain? Well, look at these joints. You see, this is the whole upper body, the head, the neck, the shoulders, the arms, the chest, the abdomen, and all that weight is on those two bones. So these two bones here are carrying the weight of your whole body, your whole upper body. And because of that, and because they're shaped like this, the weight of your upper body tends to move them away from the sacrum, which means that this sacroiliac joint is under a lot of strain all the time. Now, here's a proof that there's more strain on this joint than on any other joint in your whole body. Look, this is your hip joint. Now look at the ligaments that are holding the iliac bone to the leg bone. You see, this is all the ligaments that are holding your hip joint. Now, your hip joint is right here. Now look at all the ligaments that hold your sacroiliac joint. Look in the back and look in the front. There's huge amounts of ligaments there. And the sacroiliac joint is the only joint in your whole body that actually has ligaments inside the joint. Look at these. This joint is under so much strain. And look at the hip bone. Look at how smooth that joint is. You see how smooth the joint is? Now look at this joint. Can you see all the bumps and the hollows in this joint? This joint isn't smooth at all. Why? Because it's a shock absorber. It has to absorb the shock of every step we take. So it can't be smooth. Now, I was talking about ligaments. You know that ligaments are made up of collagen. They're sort of the girdles that hold the bones that form a joint together, and they stabilize the joint. But they also have a lot of nerves, because these nerves are telling the brain what every joint in your body is doing all the time. Like if I move my fingers, I know exactly where they are and what they're doing because of those nerves. But if those nerves are overstretched, like when you separate the ilium from the sacrum, if those nerves are overstretched, they're going to complain, and they send pain signals to the brain. So what can cause these ligaments to overstretch? Well, the first thing is pregnancy. A lot of women will develop low back pain when they're pregnant. Why? Well, remember, the baby's head has to go through the sacrum. And so during pregnancy, you secrete a hormone called relaxin. And that hormone relaxes the ligaments. And because the ligaments are relaxed, the joint can come apart and allow the baby's head to come. Now, somebody needs to be muted. I think Denise has to.
Okay. I don't see. It's okay now.
Okay, well, I'll mute you. Anyway, the joints have to be overstretched because the baby's head has to come through. If it doesn't come through, then you need the cesarean section. Now, something else that causes these ligaments to be loose is old age. I'm old, and you'll notice that I have wrinkles, okay? And those wrinkles are coming because the collagen inside, underneath my skin, is going away with age. Well, the collagen that holds your joints together goes away with age as well. And that's why people who are older are much more likely to get low back pain. Their ligaments, which are made up of collagen, disappear. They get weaker, and just like the collagen that's holding up my skin. Now, overweight will also cause problems with your ligaments. Why? Well, because if you look at these joints, they're like this. They're holding up your the whole weight of your body. And if you increase that weight, you will separate the ilium from the sacrum. And if you increase that weight, that will hurt, because then the nerves inside are going to get overstretched. Now, if you have unequal leg lengths, that will also be a problem. Why? Well, because if you have a short leg and a long leg, the short leg has to travel further and hit the ground harder every time you're walking. And that will strain the ligaments holding that particular sacroiliac joint. Or if you're double jointed, you were a ballet dancer or a gymnast when you were young, or you're able to touch the floor with your hands flat and your knees straight, or you can touch your thumb to your forearm. All these things, or you can hyperextend your elbow or your knees. All these things show that the ligaments that are holding your joints, instead of being like ropes that hold the joints together, are like elastics. And that allows the ilium from moving away from the sacrum. Now, of course, if you're injured, you can easily hurt your back. Say you fall on your sits bone, okay, that moves the sacroiliac joint because your sits bone is part of the ilium. Or if you're in a car accident and your foot is on the brake, and all of a sudden this increased jolt from the foot is hitting your hip joint, moving your ilium, and it moves it too much. You sprain your sacroiliac joint. Same thing if you jump down from too high a height. Weightlifters, you'll notice, also get problems with their back, and because of that, they use a special belt to hold their sacroiliac joints together so they don't hurt themselves. Or if you sit for a long time, I was explaining that earlier, that if you sit for a long time, you have problems with your joints that hold the weight of your upper body, and they tend to separate away from the sacrum. Now, why, if 90% of all low back pain is coming from your sacroiliac joints, why is it that people don't mention it as a cause? Because, I mean, obviously it should be a cause. Well, if you look at it with an X-ray, you'll notice that it's quite easy to see where your vertebrae are. You can see that where the disc space is, and the joints between the vertebrae are easy to see. If you look at the hip joint, you'll notice how clear that hip joint is and how easy it is to see. But look at the sacroiliac joints here. They're not regular. They're so irregular that you can't tell whether they're level or they're not level. And if you can't tell whether they're level or not, then you can't see if they're displaced. And if you can't see if they're displaced with X-rays, CT scans, or MRIs, then you can't make a diagnosis. And this is why in 90% of cases, there is no diagnosis for low back pain. Now, if we can't see the sacroiliac joints, maybe we can feel them. For sacroiliac joints, you're feeling these bulges on the bone called the posterior superior iliac spines. When one of them is higher than the other, it means that the bone has tilted forward. If the painful one is lower than the other, it means the bone is tilted backward. And that is how you can feel to see whether your joints are level or not, okay? So this is a kind of invention that I made, is that in order to be able to examine those sacroiliac joints more easily, I had the patient stand and then bend their body forward 90 degrees. Why? Well, the weight of the body is bringing the sacrum down, and the pushing up of the leg is pushing via the hip joint, pushing your ilium upwards. And so you get more of an ability to feel where those sacroiliac joints are. And what I'm feeling is called the SIFT test, the sacroiliac forward flexion test. And you can feel, what I'm feeling is the PSISs, the posterior superior iliac spines. And this is how I do it. You have to put your thumbs along the iliac crest, and you follow them down until you feel where your thumb is going to hit on the PSIS, right here. And then you take a skin marker and you mark it. Okay, and again here, you use your thumb and you feel along the PSIS. But your PSIS that I'm looking for, wait a second. Wait, here it is. Yes. Here it is. Notice that's where she feels it.
So we put a marker here. And now we can see that the levels of the two PSISs are very different.
Okay.
And I wonder if you can stand up, just stand up. And now I'm going to use a level, and I'm going to mark the exact spot, the exact level of her PSIS. So the lowest one is on the left, and the highest one is on the right. And I'm going to mark the difference between the two levels. Now I'm going to take a ruler, and I'm going to see what distance there is between the PSISs. And it turns out that there are 2.5 centimeters between the lower one and the higher one. So I put a B here for before and a B here for before. Which side is sore, by the way? Which is hurting? Left. Just the left. Okay. So we know that her left PSIS is very much tilted backwards, posteriorly. And so what we need to do now is we need to stretch the anterior part of her left thigh to pull on the ilium to bring this innominate bone anteriorly. Now, because her left ilium was tilted backwards, she is going to use her left thigh to pull on the left ilium by stretching her left thigh as much as she can. And she will hold this stretch as hard and as much as she can for the next 2 minutes. Find out whether these 2 minutes of exercise have actually helped anything. And remember that this is where the posterior superior iliac spine was before. Yes. It's not here anymore. That's good. That's where, oh, wait a second. Here it is. Okay. Your left posterior superior iliac spine is here. This is before, with the letter B, and this here is after, with the letter A. Now let's see where the right one is. Oh, that's perfect. It stayed exactly where it was. Okay, so now let's check the level. Can you make yourself upright, please? And let's see if the level. Now, this is after, and this is perfect. Okay, that's it. She's corrected her back. Don't have pain in your back?
No, it's gone.
Even when I touched it?
Even when you touched it.
Now here's a way to check it when somebody has
Sore. Right here. Oh, okay. B here for before. And then we will use the level. Stand up straight. Please stand up nice and straight. And we will be together. Yeah. And we'll see with the level. Okay, so can I have a marker, please? We'll have a marker here. And now let's measure what the distance is between the PSISs. So there's 1.5 centimeter distance between this one and this one. And this one is 1.5 centimeters higher than this one. So what you need to do is you need to bend your knee until it touches the chair and put your foot on the middle of the chair. Now lean back, Feel how your thigh goes up against this bone here when you're leaning back, and now pull up as hard as you can, as hard as you can. Just keep pulling, because what you're trying to do is you're driving this thigh into your pelvis, okay? And drive it as hard as you can, because you want to force this bone backwards. You see, if you force the bone backwards, then you'll be able to put it back where it belongs, okay? So, and now you need to hold it for 2 solid minutes. That's the mouse. Is this still hurting? Because this is where she's at now. That hurts now, but look, this is where she's at now. Let's see if she's level. Let's see if she's level. There she is. Perfect. She's level. She's fixed her own back.
So essentially, the rules for correcting a displaced pelvis, once you've located the PSISs, essentially you need to compare the height of the 2 PSISs. And if the painful one is higher, that means you need to use a higher thigh. If it's lower, you use a lower thigh, because you want, if it's higher, you want to push it back. If it's lower, you want to pull it forward. And you hold that position for 2 minutes. Now, this is 2 of the exercises that you can do. You see, this is if it's displaced, if it's the PSIS is higher, then you use the higher thigh. And if it's lower, you use the lower thigh. But sometimes you need to correct both. And this is the way where you can use the higher thigh here and the lower thigh there, so you can correct if there's pain on both sides. Now, this here is a man who had 43 years of horrible low back pain. And because of that, he had 3 surgeries to fuse his lumbar spine. They started fusing L4-5 to begin with, and then they went a little higher and a little higher until this was 3 weeks after his surgery, and his lumbar spine had been completely fused, and he still had the same pain. Well, it turns out that there was only a centimeter difference between his higher and his lower PSISs, and that caused him unbelievable pain. But he was not able to do those other 2 exercises because he couldn't move his lumbar spine. So this is one exercise I did with him, and that I do for other people who cannot move their lumbar spine.
On the very edge, and okay, that's it. And now bring your leg up like this, and now lie back. Lie back, lie back, lie back. Okay, that's it. Now I'm going to put your foot on my chest here, on my sternum, and then I'm going to lean forward hard to push this bone again. You see, I'm pushing your thigh against your ASIS, okay? Very hard on this bone here to pull that ilium to the front, okay? And I'm pushing very hard on this one to push that thigh against your ASIS. And we're going to hold this for 2 solid minutes.
Now, I did this study on that. Once I discovered this in 2013 or so, I decided, and I was getting a lot of success in relieving my patients' pain. And so I decided to do a chart review because I wanted to know how many people who had low back pain were actually relieved by this exercise. And what I found is that of 180 people who had low back pain, only 16 had pain coming from their lumbar spine. All the others, there were 164 people who had displaced PSISs. And when I looked at these people and I gave them the corrective exercise, 50% of them had complete pain relief immediately after doing the 2-minute exercise, and another 28% had partial relief. So at least 78% of them were having pain from displaced sacroiliac joints. So it's the commonest cause of low back pain. Now, once the pain is relieved, some people get the pain again and again and again. And so there are ways of avoiding having the pain come back again and again and again. One of them, if for people who sit for a long time, is something that I'd like to show you now. I'm sitting on one of them. This is a blow-up. We call it a donut, and you can buy it online on Amazon or any online store. It costs about $13 to $15. And if you sit with your sits bones inside here, if your sits bones are here, they can't separate. So that means that holds, because your sits bones are part of your ilium, that holds your whole iliac joint together and your sacroiliac joints together, and you don't have pain. Now, the other thing you can do is when you're doing exercise, which you know will give you low back pain, use a pelvic support belt. And I will show you how to put on a pelvic support belt. The permanent repair you can do to your sacroiliac joints comes with prolotherapy. So here is information about the pelvic support belt to begin with. Yes. And that allows you to put it here and around your body. And where are the two little bones that are sticking out? They're right here. You can feel the two little bones that stick out right here. Okay? Put your fingers on the two sticky outy bones, okay? Because this is where you want to put the belt, just below the sticky outy. Okay? Is that you want to hold this part of your pelvis in place. You do not want to open up those joints. If you put your belt here, you're opening up the joints. That would be totally counterproductive, because then the joints can really go out. What you want is you want to make sure that those joints are well held together. So your belt is going to go right here, like so, and like so. Now, get the two little bones and pull on forward. That's it. There. Yeah, that's it. Now, do something that would hurt your back. Is it hurting now? No. That's the name of the game. You can bend over as much as you want because your pelvis is being held in place.
You might get up. I feel the most pain, but this time I did not feel any pain.
So this is the name of the game. You want to have something holding your sacroiliac joints together to avoid having low back pain. Now, I did a study on that. How effective was the belt and how effective was the exercise? So I took 62 people. There were, and I divided them into 3 groups. There were 21 who used the pelvic belt, 21 who did the exercise, and 20 who did the usual care. And so look at what happens at the first visit when they do the exercise. They start their pain at 5.2 and they bring it down to 2 immediately after doing the exercise. And then, of course, they were pain-free, but when they came back a month later, their pain was still there, but it was less than at their first visit. Now, same thing with the belt. This is the people who had the belt, and they still had pain because they didn't do the exercise, but as soon as they got the belt, their pain went down. But at the end of the month, they still had some pain, but less than when they came back. Now, the people who were receiving conventional treatments stayed with their pain for the full month. You see the difference between the conventional treatments and the others. Now, at a month, I gave everybody the exercise and the belt, and so everybody got better. And at 2 months after using the exercise and the belt, everybody was feeling better. And when they did the exercise in the office, they got even better. So I know that this exercise will make you better. But some people still have pain once they've done the exercise. And what could it be? Well, the thing is that when your ligaments fail, then to hold the joint together, you need to use muscles. So instead of the joint being held together by your ligaments, it's your muscles that are holding the joint. And these muscles, most of them attach on the iliac bone, the ilium here, and they attach on the covering of the leg bone or the hip bone. Okay, so and these are the muscles that are involved. One of them is called gluteus medius, gluteus minimus, piriformis, all kinds of these muscles that hold the hip joints together. And in the front, you also have muscles like this muscle, the iliacus, that attaches on the iliac bone and attaches on the inside of the hip. So what happens when these muscles are overworked? Remember, they have ligaments too. They have something called tendons, which are also these white things that have fibers in them. Well, these white things with nerve fibers in them are sending pain signals to your brain. And so you get pain in the hip where these tendons attach. And in the same way, these tendons will give you pain in the groin or just below your groin. And you'll have a hard time lifting up your leg, for instance, because these are the muscles that attach and lift up your leg. So these things, and if you have pain in your hip, the worst pain is usually at night when you're lying down on them because you're squishing those nerves. They don't like it. So these are things that can give you pain when you have. Now, there are other things that can cause pain. And these things are often called sciatica, but they aren't. There is a nerve called the lateral femoral cutaneous nerve. That nerve crosses right in front of your pelvic bone. And when your pelvic bone is displaced, that nerve gets squished. And when that nerve gets squished, you see that nerve travels to the side, the front and the side of the thigh. And so you get pain on the front and the side of the thigh, and it's nerve pain. It's burning, it's tingling. It's just like sciatica, except it is to the front and to the side of the thigh. Now, this is something that is very much ignored by a lot of doctors. And yet, if you replace the iliac bone, that pain disappears. If you also use, because that nerve is very close to the skin, if you also use the cream I've invented, it'll take away the pain. Now, this is how you can examine your own sacroiliac joint and fix it yourself. But you'll need somebody to observe you. If you want to find out where your sacroiliac joints are, you just slide your fingers up your buttocks and you hit these little bones. I can see that my fingers are going up over these little bony obstacles. This is how you find the level of your sacroiliac joints. Now, if one of these fingers, instead of being level, is higher up, then you know that your joint is displaced forward. You see, if these are the bones that you're looking at, the one that's going to be higher up shows that the bone is displaced forward. Now, if it's displaced forward, the way to fix it is to push it backwards. In order to push it backwards, you're going to use your thigh. Watch what I'm doing. This is how you're going to replace a forwardly displaced sacroiliac joint. You put your right foot on the floor, because this is the right joint, and you lean forward hard on it like this. And meanwhile, you push your left knee backwards to stabilize the other joint. And you hold this position for 2 solid minutes. Now, supposing that the joint is displaced backwards. If this finger is lower, like so, it means the joint is displaced backwards. If it's displaced backwards, you see, if it's lower, it's displaced backwards. If it's displaced backward, you have to pull it forward. Now, to pull it forward, what you do is you're going to put your knee on the floor, and then you'll put the other foot forward, and then you're going to lean forward and move that knee as far back as you can, because what you're trying to do is you're trying to pull this bone forward. If you want to pull it forward, you have to feel a real pull in your groin area. If you do that, then hold it for 2 solid minutes. If you hold it for 2 solid minutes, that'll give the bone a chance to move in the direction it should. So now you know how to fix your own low back pain. But the way to do it is have somebody observe you to make sure that you don't go in the wrong direction. Then don't do the exercise on the other side. You could stand up right now and just check your own PSISs and see if you can feel them. It's not that difficult, and it might be something that you might want to know how to feel. It's better if you're standing up when you feel it. And I'll show you where to feel it, okay? You just go here. You see how my fingers are going up against this bone? And I have no back pain right now, and so they're level. If I had pain in my back, they wouldn't be level. Now, this is this is information. If you want to know where the research is talked about, you go to this one. And if you want to have a summary of the exercises, you go to YouTube. So this is where you can get information. And I think I might even put this meeting in YouTube. So, and if you have pain somewhere else in your body, I've invented a lot of things, and I've invented a cream that shuts down pain. It stops pain. How does it do it? Well, I'll tell you how I discovered it. I was injecting people who had, say, pain in their hands. I was injecting the nerve that was going to where they had the pain. I was injecting just around that nerve with something called mannitol. It's a natural sweetener. And when I injected the mannitol in there, before the needle was even out of the skin, the pain would disappear. And there was a pharmacist who was looking at me doing this, and she said, you know, like, people don't like injections. Why don't we make it into a cream? Well, we tried 16 different bases until we found one that allowed the mannitol to penetrate to the nerves that were causing pain. And so when I did that, I found that my patients were getting tremendous pain relief. And of course, the closer the nerves were to the surface of the skin, the better the pain relief, because the mannitol shuts down the pain signal. And this is what I found. I tested it on 235 of my patients who had 279 different pain conditions. And I found that the average relief was 53%. Well, okay, it's not 100%, but the average pain relief for narcotics is 36%. And for Voltaren, it's 23%. So 53% is not bad. And I found that it worked beautifully on legs. It's more than 60% pain relief on fingers and hands and toes, because that's where the nerves are closer to the skin. It gave between 50 and 59% relief to all the yellow areas, and 40 to 49% relief to all the orange areas. You can use it for everything from migraine headaches to untreatable itch. And so if you're interested in finding out more about it, go to the website qrcream.com. And that is the end of my back pain talk. And do you have any questions? I will get out of and I will ask you for questions. No questions? If you have questions, just click on the little reactions tab. If you click on the reactions tab, you can raise your hand. No questions? Sandra. Okay, so what is your question, Sandra?
Helene, I am so delighted that I met you the other day in the Alignable group. Unfortunately, I was not in front of my computer till literally a minute ago. I want to know if there is a way to watch a replay of this, because I was driving trying to watch you measuring these uppers and lowers, the befores and the afters. I didn't want to run anybody off the road, but I know from just what I heard and glanced at periodically, this may be the solution for my back problem, because I've had radio frequency ablation and all kinds of crazy things with nerves and the facets and this and that and the other. And I still, now I'm wearing, I wear a back brace, and the doctor said, oh, you shouldn't do that. It'll weaken your muscles. Yeah, but he's not the one with the pain. So I would really love to see this again, if that's humanly possible, so I can try to figure out what's the deal with my PSISs, because yeah.
Sandra, I'm recording this right now, and you will have access to the recording. I'm going to send it to you once I have it.
That's
So,
awesome. Thank you, thank you, thank you. God bless you.
well, and congratulations, you found the best way to treat low back pain. I'm so glad.